From your perspective, what does decriminalization of substances mean?
Yeah, decriminalization would really mean that we have like a formal policy to be able to look at people who are using substances around enforcement, right? It would really allow us to break down the structural barriers around that. Right now, a lot of policing organizations don't charge people when they have personal use amounts. But that's really dependent on the officer, really dependent on the situation. And so that means that there's opportunity for racism and oppression, and that people who are from racialized communities or equity-seeking groups are more likely to be oppressed because they're always more likely to be oppressed and more likely to be criminally involved or have police involvement. So a decrim strategy would really shift this from a policing issue to a health issue. It will allow us to support folks the ways that they need to be supported rather than incarcerating people, and really take some of the burden off of our court system for dealing with a health issue.
Advocates say that decriminalization may help address the drug poisoning crisis or produce other community benefits. I wonder if you could comment on that, as well as what your general perspective is on about what kind of value decriminalization might offer Kingston.
I kind of alluded to the fact that the court system is probably one of the more costly parts of decrim, and same with incarceration, right? It costs about $220 a day to incarcerate somebody provincially. That's even more federally. So when we look at the amount of money that we're putting into the system to be able to incarcerate a health issue, I think we really need to talk about where our values are. Is taking somebody out of the community really going to address their issues? We need to be looking at this as folks need supports. They need help. What we're doing isn't working. We've been criminalizing drugs for a long time, and we've seen no success, right? People are using substances no matter what. So if we shift the conversation and we're able to support something like decrim, this can really allow us to start investing in the infrastructures of supporting people, right? This means we can have more supportive housing. We can have more access to healthcare, mental health care, being able to increase supports for those organizations that already respond to people using substances, and do that in a way that's more effective than incarceration. That would be a huge impact on our system. It really shifts this to focus on the person and not the system. And I think that's where we're seeing the failure, is we're so system focused that we're not having results. And if we focus on the person, we can really start to see people being their best selves.
I want to back up for a moment and just talk a little bit more about what decriminalization is and isn't. So I think you alluded to the idea that it would mean that if people were possessing maybe a certain amount of a substance that's, illegal, that they would not be charged. So I guess a flip side, or another question to ask, is if that's what decriminalization is, what is it not?
Yeah, so decriminalization would not be for possession for the purposes of trafficking. This is not about higher level organized crime. This is this is really about individuals who are struggling. The idea is that it would be shifting the responsibility to give supports rather than incarceration.
So do you see you've talked a lot about the kind of additional services that maybe are needed to support people who are using substances rather than criminalizing them. I wonder if you have any thoughts on, do you see any drawbacks to decriminalization, or do you have any thoughts on how it's been implemented in British Columbia that we can learn from here in Ontario?
Yeah, I think there has to be a shift in Ontario to really get the full benefits of decrim. I think BC has already created this culture of wellness and mental wellness, and there's been a lot of investments in their mental health system, and not just traditional service providers, right? It has gone across the scope. And so...
Could you give an example of something that you think BC is doing well in terms of mental health supports?
Yeah, like I think they're using it as an opportunity to talk about like the environment and, you know, housing and a lot of those challenges that are drawn into substance use, right? Because a lot of the reasons why people are homeless or not having access to adequate income have to deal with that, right? So I think if we really look at those models and say, what's going well? What can we do to learn from that experience? Then we'll be able to respond appropriately to Ontario. And so if we are able to increase our mental health services, if we're able to increase supports for our hospitals, you know, staying away from privatization and ensuring that there's public access and free supports, that we really do allow us to respond in a health-oriented way rather than a moral way, we're able to reap the full benefits of decrim.
Right, and I think that you're referencing the need for additional supports is something that many people talk about, and also that why decriminalization alone isn't a solution, right? It needs to be part of a broader picture of things, but at the very least, this idea that if people have a health issue, why would we charge them for that, right?
Yeah, and if we're able to divert those funds, right? Like right now, 80% of our provincial jail population is on remand. That means they haven't been convicted yet. So these are folks that are awaiting bail.
80%?
80%.
Wow.
So before the pandemic, we were at that level, and it's only taken us 3 years to get back to that after the push for de-incarceration during the pandemic. So like we really have to talk about what's going on with our system. How are things broken? How are we not supporting the presumption of innocence? And how are we not supporting these folks when they're struggling in our community? Jail is the only social service that can't say no. So, you know, where people are struggling, they're arrested. And then we're expecting them to get better in incarceration and then come back out into our community. So, you know, if they're already dealing with substance use, if they're already dealing with these challenges, putting them back in doesn't effectively deal with that.